thanking. Let me start by thanking Pastor Andrew Bukenya for organizing this webinar, which is amazing because it's very much needed. So I thank you for all the logistics and arrangements and planning and preparation and enabling this webinar to take place. And I'll just start by a few opening remarks. Just bear with me. So good morning, distinguished guests, healthcare professionals, community leaders, survivors, carers, and friends. It is both a privilege and an important responsibility to welcome you all to the Prostate Cancer Awareness webinar. You all, and it is absolutely particular focus on Black and ethnic minority communities across United Kingdom and around the world. Today's event is not simply about medicine, it is about saving lives through awareness, education, early diagnosis, equity, dignity, and courageous conversations. Prostate cancer is now the most commonly diagnosed cancer in men in the United Kingdom. More than 64,000 men are diagnosed every year. Over 12,000 men die annually, and more than 540,000 men are living with or prostate cancer or after prostate cancer. However, the burden of this disease is not shared equally. For Black men, especially men of African Caribbean heritage, the risk is significantly higher. The current data shows that 1 in 4 Black men will develop prostate cancer during their lifetime. Black men are twice as likely to develop prostate cancer compared with white men. Black men are more likely to be diagnosed with a later stage. Health inequalities continue to affect access to diagnosis and treatment. These statistics are deeply concerning, but they also give us a clear mandate for action. In many of our communities, conversations about men's health are often avoided because of fear, stigma, embarrassment, cultural barriers, misinformation, or simply lack of awareness. Too many men wait until symptoms become severe before seeking medical advice. Yet prostate cancer, when detected early, is often highly treatable and curable. This webinar therefore aims to increase awareness of prostate cancer risk, encourage early conversations and screening discussions, empower men and families with accurate information, address myths and stigma within Black and ethnic minority communities, promote equitable healthcare access, support survivors, carers, and families affected by prostate cancer. We also recognize the emotional and psychological dimensions of this journey. The diagnosis affects not only the individual, but partners, children, families, workplace, friendships, and entire communities. So we stand together this morning in solidarity, compassion, and hope. We are grateful to our medical experts, clinicians, researchers, advocates, and community champions who continue to work tirelessly to improve outcomes and reduce inequalities in prostate care. Pastor Dr. Andrew Bukenya is one of them. Most importantly, we thank every participant joining us here today. Your presence demonstrates leadership, responsibility, and commitment to protecting the health and future of our communities. Let this webinar be a catalyst for earlier diagnosis, for informed decision making, for open conversations, and ultimately for saving lives. Thank you once again for joining us this morning. And now move over to our excellent and learned professional who is going to assist us in starting the discussion. And she is Ellie, a registered nurse, originally from Australia, where she first started working in oncology nursing. She has worked in both oncology wards and chemotherapy units in Australia and in the UK, and have joined Western Park Cancer Charity since February this year. Ellie's role at the charity is to provide emotional support and education to the community in South Yorkshire. Please put your hands together to welcome Ellie and Pastor Andrew Bukenya to start this very important prostate cancer awareness webinar. Thank you.
Thank you very much. If it's okay, I'll go ahead and start. The way that I would like this to run today is I've got a presentation, as well as I'll be talking through everything that I've got. It's mainly about awareness, signs and symptoms, uh, what kind of tests you can do, and just a brief on what treatments are available for prostate cancer, as well as a bit about what the charity does. If anyone has any questions, feel free to write anything in the chat. I will have a slide at the end where I'll take any questions and I'll do my absolute best to answer them, as well as I'll leave my contact details for anything that I'm not sure of and I can get back to you. But I will let, if everybody can, I'm happy for you to unmute if something happens and you can't hear me or see me anymore. But otherwise, I also let Vicky, my colleague, just, if you can keep track of if there's any technical issues that I'm not aware of as I start. But if everyone's ready, I'll go ahead. So,
We are ready. It's only that you dropped your volume a bit. I don't know if it's on my side, but you sounded louder before than now.
okay, how's this? Perfect. So I'm sharing now. Hopefully everybody can see my screen. Is there any issues with, can everybody see my screen?
I can see your screen saying Western Park Charity has started. Right, there we are. It's there.
Yeah, perfect. All right. So yeah, we got a very good introduction, but today my little talk is just going to be about, it's really going to be very basic about what an actual prostate is, what cancer is, and everything that we should be aware of, just a basic level to give you the understanding to be able to be a little bit more in charge of your own health. Yeah. So the very first bit I've got is, what is a prostate? So we hear, yeah, prostate cancer a lot, but a prostate, and I've included, if you can see my screen, this little diagram. So it's just here, this being the inside kind of our bodies. So it's a small gland below the bladder, this being the bladder. It's what it's used for. What it is, it's only in people born as male. It's responsible for making semen, and it controls the flow of urine from the bladder into the urethra. So you've got your kidneys, which the waste comes through to your bladder, which is what we know as urine, and which comes out the urethra. And the prostate gland is basically a little gland that sits around that urethra. And this is really important to know and understand, because as we come to talk about signs and symptoms, you'll understand why some of the symptoms come across the way they do. And again, it's just a little bit more understanding of our bodies, and why things may or may not be concerning and what could be going on. So then there's, what is cancer? So cancer, another word that, we hear a lot of, but just give you a really quick kind of, the way I view it in, I think, the most simplistic terms. So our body is full of cells that are always dividing and replacing themselves. And this is a normal bodily function that we do all the time. Sometimes it can be due to external factors, and sometimes it just happens. So we know things like smoking or getting sunburnt, but especially in terms of prostate cancer, we're not always sure why this happens. But during the replicating process, there is a change in an abnormal cell, appears, and this can rapidly grow and then spread. And this is what we call cancer. So sometimes when there's an abnormal cell and a clump of abnormal cells, you hear the words benign and malignant quite a lot. So benign, what that would mean if you went to a doctor about a lump and they said it's benign, means that it's growing quite slowly and it's localized to a certain area. So you might have a lump any part of your body. For example, an easy one that people usually understand is a breast lump, and that is not cancerous and it's not going to spread. It's just a lump. We say it's benign. If something was malignant, that means that it would be, a cancer diagnosis, and those tend to grow and they can spread into different parts of the body. Also, when we talk about cancer, and today we're talking about prostate cancer, you hear breast cancer, prostate cancer, bowel cancer. This is always referring to the primary cancer. So that's where the first start, this tumor is found. So as we know, sometimes without intervention, and if you are not catching these early, they can spread into other parts of the body. It doesn't then become a lung cancer or a bowel cancer, rather still a prostate cancer diagnosis, if that's where it started, and we call it metastatic prostate cancer. The other areas where the cancer is spread to being called metastases. But I think what's important to take away from it is that, cancer is just abnormal cells, and it's just about getting to it early. And what that means is that you're preventing the spread and able to contain it to a small area of the body where it's more likely that you can have surgery as an intervention, and you can have more targeted therapy rather than treating a cancer which is already spread, where it becomes really hard to treat and there's less options. I can just hear, I think someone may have just unmuted. If Vicky, you could just have a look, unless anyone wanted to ask a question, if anything was unclear, if that person could just be muted.
Well, unmute yourself.
You can mute them. You can mute them.
Yeah, the host is the one who can mute them.
Okay. All right. I'll continue on. So signs and symptoms. So this is where I was talking about understanding your anatomy and prostate cancer and how that usually presents itself. So what we do also need to address is that often prostate cancer has no signs and symptoms. So it's not always going to present itself through one of these, but if people do get symptoms, these are usually the ones that show up. So it's a lot to do with urinary frequency, so how often you're passing urine, and just kind of a change in habits. So because it is a gland that's around the urethra, if there was a growth, it can sometimes block or make going to the toilet a little bit more difficult. So men usually find that they might have difficulty urinating, straining, having a weaker flow than normal, changes in frequency, so maybe going to the toilet several times throughout the night when you didn't used to, not feeling like your bladder is completely empty, and as well as erectile dysfunction, as well, being with a blockage of the urethra, potentially by that tumor. So if you're noticing any of these signs and symptoms, it's definitely worth going to your GP and bringing them up. It's not always, and what I do really want to stress as well is that most of the time when abnormalities happen in no matter what part of your body, it's not always going to be cancer, but there's still other things that can be done for other conditions. So the whole message of today as well is to not be afraid to go to your doctor and get these things checked out, because it might not be the worst case scenario, and you will have more treatment options and better control over your health if you're presenting early, as soon as you find something different in your normal bodily functions. And this goes for any part of your body as well, not just when we're talking about prostate cancer. So I know we've already heard quite a lot of these facts and statistics. So these are all from Prostate Cancer UK. But it is the most common cancer that has been diagnosed in the UK at the moment. There's approximately 64,000 men who are diagnosed every year with prostate cancer in the UK. About 12,000 men are dying from it each year in the UK. It does disproportionately affect Black men. We don't have, unfortunately, like some other types of cancers, preventative measures that we can take, like wearing sunscreen to protect your skin, or other things like that. But we do know that for some reason Black men are being disproportionately affected. So it's something that, if that's relevant to you, to be aware of in yourself as well, as 1 in 4 Black men are diagnosed with prostate cancer in their lifetime. So the only reason I've included this, it's not to scare you or to make you worried. It is just something to be aware of, to know that it's not to sit there and think, oh, it won't be me. Unfortunately, 1 in 2 of us are affected by cancer in our lifetime and have a diagnosis. So it's just understanding, what this means, this being the most common type, and am I more at risk, and what can I do to really be in control of that? Okay, so screening and tests. So a lot of you might have heard of things like a mammogram, which is like the breast cancer screening, and you might be thinking, oh, I haven't heard of one. Sorry
for the interruption. I don't know if you're going to get to that at some point, but while you on this previous screen before, is there any reason for why that is what the statistics are, or why the disproportionate representation? Is there any research about it, or it's unknown?
I think at the moment it is unknown. I'm not sure exactly what kind of research they're doing, but it is just a statistic that they've found, so we don't know why. So that's what I mean. I can't unfortunately give you, like some of the other types, advice for what you can or can't do. Obviously your ethnicity is completely out of your control. It's just something to be aware of. At the moment there's not a clear reason as to why that is. Was there any other questions about that last slide, or?
If I can interject,
Of course.
there may be a hereditary component. There may be diet. There may be quality of life, so obesity, and then other predisposing conditions may be contributing. We don't know the linkages, but diabetes is one of them. Renal disease, another one. So those are interlinked, renal and diabetes. But the major factor is ignorance in terms of identifying and diagnosing and treating. But the causal factors, what causes it, is all the combination of all these things. But there's no specific cause identified. I hope that helps. Thank you.
Yeah, thank you very much. No, feel free to interject as well. Yeah, thank you very much for that. That was very useful. Yeah, so I'll just continue on with kind of what screening and tests are available. So, and this is speaking from a UK point of view. There isn't a national screening test, like I said, with the example of a mammogram for prostate cancer, but there are screening and tests available for you that, they obviously use tests to diagnose prostate cancer. So what you need to know is you're not going to be called up for a screening test. It won't be like the bowel cancer screening or the breast screening where you'll get a letter. It is very much up to you to take on this element of your health. So there's 2 different tests, and the reason that they're not carried out through a national screening program is because well, especially with the blood test. So one of them is a blood test. It's called a PSA test. It's not important that you remember that, but it is called PSA, prostate specific antigen test. That test is as simple as a blood test. It's not funded nationally to, call all men or all people born with a prostate up for screening, as it isn't 100% accurate, which means that you may get a high level of this PSA in your blood, and that could be due to other factors, which aren't cancer. And, likewise, you could have a high PSA and you could not have a high PSA, and you may still have prostate cancer. So as it's not the perfect test, the government is still not 100% sure about bringing that forward to be a national screening program, as it cannot be completely reliable. But if you are in the UK, and I encourage you, no matter where you are in the world, to go and see your doctor and ask for a PSA test. Be encouraged that, especially in the UK, I believe if you're over 50, the GP cannot refuse for you to have a PSA test. So if you say it's something that I'm worried about, I'd like to have this blood test, all you need to say to the GP is, can I please have the blood test that, could be an indication of prostate cancer? They should know what you're talking about. That's PSA test. And from there, they can kind of have a better view of if you're needed for extra tests, any further testing or not. And the other one that I've got up on the screen is called a DRE. And this is one that a lot of men kind of shy away from. So it's called, it stands for digital rectal exam, which is essentially a finger feeling up the rectal canal up to the prostate. So obviously that's quite an intimate and for a lot of people an uncomfortable test to have, as it's quite invasive, which I understand. But what you do need to know is that may be asked of you, especially if you're getting something like a PSA, an abnormal PSA result, if you're having symptoms. Or sorry, is there a question there, or a doctor may recommend this for you, especially if you've got things like that we were just bringing up before, like family history and things like that. So this test is a bit more reliable. So just in terms of when a digital rectal exam is done, the clinician that's conducting the exam will be able to feel the prostate and be able to just feel if there's any abnormalities, such as a nodule to the side, which could indicate that there is, prostate cancer. But it could also lead to the diagnosis of other issues, such as an enlarged prostate, which is really, really common amongst men, especially as they get older. So this type of test, although it's invasive, I do encourage you to try not to shy away and be honest and upfront with your GPs about any symptoms that you're experiencing. Your GP should be, wanting you to get this test done by whatever means that is, to keep you comfortable, whether that's to have a chaperone, if you would prefer a male or female clinician to do it. All these things can be accommodated for you in order for you to get the, remove barriers from you getting the test done that may be vital to getting a diagnosis early on. Because, like I said, with prostate cancer, you're not always getting symptoms, especially at an early stage when it's contained to the prostate and hasn't spread to other parts of the body. So these tests might be needed even if you're not feeling unwell or experiencing any of the symptoms that we've been through. So yeah, just really important for you to understand what might be asked of you. And I think with that knowledge comes a bit more strength to come forward and say, you know, I want to be checked out, and I want to know what's going on with my body.
A question for you, Ellie.
Go for it.
So regarding the screening, again,
Yes.
I don't know if you have any statistics there, because regarding people of African and Caribbean heritage and other races, do you know any statistics about many people, which representation is keen on doing the screenings, and do you hardly see any African Caribbean people coming for the screenings or not?
I don't actually have any statistics on that, but I'm not sure. I mean, if anyone else has got any and they would like to share, that's absolutely welcome. Otherwise, I was thinking I can look into that for you going forward, and maybe be able to send some websites through with statistics of how many people, you know, of the Afro-Caribbean community are getting screening compared to the wider community. I'd be happy to have a look into that for you.
Can I just say that there are no mass screening programs in the country, Pastor Andrew. You know, there isn't a walk-in screening program. You have to have symptoms, and then you go, and the GP does the screening, does the test. So it's that's why the awareness is very important about the signs and symptoms immediately, because early diagnosis is the key. And that's why we're having this webinar about raising the awareness about the signs and symptoms. Once you are in the system is geared up to treat you very well. But it's the early diagnosis and awareness. So it's like women's breast screening. You know, they just have open centers. They go. We for sexually transmitted diseases, we have clinics. People just go and get treatment because they have symptoms or signs. Prostate cancer, we don't have a walk-in clinic. You have to go to a GP practice. And that's why when during COVID, when I was in charge of trying to raise awareness and get people to attend COVID clinics and vaccinations, I suggested that we use pharmacies, we use places of worship, community centers, even post office, because at the post office, the marginalized communities had to go and get their money because they didn't have bank accounts, they didn't have anywhere to manage their finances. That's where they went. So there's a lot of awareness raising because people just don't turn up. And then if Black and ethnic minority communities, you were talking earlier on about the risk factors. You know, it's first of all, it's the age. If you are 45, the normal age is 50. But anything Black and ethnic minorities, if you're 45, you should just go for a test. And then if you have family history, like father, brother, uncles, aunties, even, you know, history of breast cancer and ovarian cancer. And then the lifestyle things that I mentioned earlier on is obesity, poor diet, physical activity. Strangely, but interestingly, alcohol consumption and smoking is also considered part of the risk factors. So I hope that helps us to guide and move along. So how long have you got to do the presentation, Ellie? Is it more because some of the questions might be answered during your presentation.
Yeah.
And the other one was, could you please up your volume, because there are a couple of comments in the chat section that the volume is low or they can't hear. Thank you.
If I speak a little bit louder like this, is this a bit better? Yeah, because I've just got my laptop before. Sorry, I think it has been a bit up and down. But I will try to talk at this volume. Please let me know, if that's an issue going forward. But yes, thank you very much again for your input. Yeah, it's just tests that you're not going to be called in for, exactly, I think is the main takeaway. So yeah, to be presenting yourself to your GP and saying, I've got symptoms, or even that I don't have symptoms, can I still get this test done? You know, I would like to take charge of my own health, and it's a bit of reassurance to be able to know that you've done what you can.
There's a question, Ellie, if you do that, then there's a worried well syndrome. You go for a test and it just turns up, the PSA is higher, and then you start worrying, but actually it's not the treatable thing. So there's that balance of risk about but if you have a mass screening of everybody above 50, then ethnic minorities at 45, then we might get the answers that we're looking at, the prevalence, the epidemiological and public health information. So that's a gap. That's why we're talking about inequalities. How do we address those inequalities? Sorry. I won't interact now.
No. You're more than welcome to. And
because
I
it
guess
just might prevent or answer questions that are in people's minds as to what to do.
No, that's really helpful. And I guess that's another reason why they've not carried it out as a national screening program, because exactly it can cause worry, obviously, if you've got a high PSA level. So it is just definitely a conversation to have with your GP, and just to be aware. So no, thank you very much. I'll move on just to other prostate issues. Enlarged prostate, I've already mentioned these things like a UTI. It's just about understanding that if you are having signs and symptoms, it may not be prostate cancer. But again, these are issues that you can resolve with your GP and get treatment for. Even an enlarged prostate, often the signs and symptoms that people are having that can be prostate related symptoms are quite uncomfortable and make it quite difficult to live your normal life when you're needing to go to the bathroom quite frequently. So just, I guess I put this slide into the presentation today just to assure you that even if it's not for a cancer diagnosis, that the best thing to do is always to go to your GP and you can get medications that can help you to live, a much, smoother life without these signs and symptoms, which can be, can get in the way of your everyday life. So it's just a bit of awareness about that, and knowing that if you get these signs and symptoms, it doesn't 100% mean that you have prostate cancer. Treatment. So I won't spend too long on this, because every different type, every person who's got a cancer diagnosis, basically, your treatment is very individualized. So a lot of people think of cancer and think of chemotherapy and losing all your hair, and it's a lot bigger than that. And especially with prostate cancer, chemotherapy is actually not one of the main treatments that they use. It definitely can be used, but mainly in a setting where the cancer is spread to other parts of the body. So it's just important to know that as well, if you're getting a diagnosis, or people with a diagnosis, just having a little bit of a deeper understanding about what they might be going through. So one of the treatments that they can use is a hormonal treatment. So this is as well why we're talking about risk factors. And thank you for bringing up, so if you've got a family history of prostate cancer or breast cancer, something like that are hormone-related or driven cancers, that can be hereditary and therefore place you at a higher risk. So it is important that you're aware of your family history, or if you have a diagnosis, to make your family aware. Because one of the treatments they use is a hormonal treatment as well, and it might be one of the treatments that they use. So if you've got a prostate cancer diagnosis, so the treatment lowers the testosterone, which would feed the cancer, and obviously make it bigger. Another type of treatment they can use is active surveillance. So this is just regular testing and scans at your hospital. So they may not need intervention straight away. It might be a matter of obviously surveillance, testing, and seeing how it goes. There's also watchful waiting, which is a term they use for regular checkups and blood tests at your GP. So another type of, we know that you've got a diagnosis, but sometimes the spread is slow and it isn't necessarily, that worst case scenario I think that everybody automatically thinks of when they hear the word cancer, and, big massive surgeries and chemotherapy. It can just be a matter of waiting. So you really are so much better equipped to understand what's going on with your health, go to your GP early, and then your treatment options as well. All these ones could be available to you. There's also a few more. So radiotherapy, this can look quite different. They've got, a lot of different types of radiotherapy, including a seed that they put into the prostate gland that delivers, radiation kind of internally and slowly over time, as well as your typical radiotherapy involving you going in. It might be weekly, daily, depending on your treatment regime. Surgery, where they remove the whole prostate gland, especially if this hasn't spread. This can be really effective. And chemotherapy. So chemotherapy, which is obviously a little bit more of my specialty, is what I've worked in. So chemotherapy is where you're damaging cancer cells by interfering with their replication, which is what I was saying about the spread of cancer moving throughout your body. So it's as well why it's mainly used when it's spread, but it can be used for prostate cancer, but it won't be, none of these will be kind of a one story for everyone with a prostate cancer diagnosis. And yeah, there are options, and the earlier that you get a diagnosis, the more options and the less invasive options can be available to you. So yeah, it's really important to try and get in there with an early diagnosis. That was mainly what I had planned for the awareness side, but I was just going to quickly go over what the charity also does. So I understand that there's people here globally, and not just from South Yorkshire, but the charity that I work for is called Western Park Cancer Charity, and we offer a lot of services. It's to anyone within South Yorkshire, so it can be, this is available to you if you're worried, you've got a question about signs and symptoms. People can often find that as well they're not being listened to maybe, or getting the advice they were expecting from their GP, and they still feel concerned. Western Park Cancer Charity is here to help with that. We call GPs for you if that's something that you're struggling with, and can write you a letter as to your concerns to help you be seen, because I know unfortunately sometimes GPs can push back a little bit as they're really busy, at least definitely in the UK setting. So we're here to help with people who have a concern or have even a question. If any of the information I went over today, you go, oh, is this for me? Should I be getting, say, one of the screening tests? That's something that you can come to the charity with, and we can advise you for. We also support anyone with a diagnosis and anyone that's supporting someone with a diagnosis. So it can be a relative. It doesn't matter if it's your mum or your dad or your brother or your sister or your best friend, or a neighbour that you're close with. We understand that cancer affects us all, and emotional support is available from a healthcare professional for anybody affected by cancer in the South Yorkshire region. We do also financial advice. So if you're finding yourself, you've got a diagnosis now and work looks different, and you're not sure what to do because you're needing to, you've got extra things on your plate with having, the cancer diagnosis, we do free welfare support. We've got free legal advice and then subsidised going forward. We do workshops like this, but we do also a prostate cancer support group. We've got other peer support groups for other people who either have a cancer diagnosis or are supporting people with a diagnosis, to build community and I guess share experiences of what you're going through. We do a free transport service to Sheffield hospitals if you're in the greater community, such as in Rotherham, Barnsley, Chesterfield, and we do complementary therapies. So for anyone with a diagnosis and their main support person, you can just take some time for yourself where you can get a massage done, or, you know, take some time out and have some Reiki or some other kind of relaxing therapy as well. For people who have prostate cancer, part of the hormonal treatment can sometimes leave you with side effects, which we've got some acupuncture, auricular acupuncture, which is acupuncture in the ear, which can, this acupuncture is directly linked with helping those symptoms. So we've got quite a lot available. And I think on the next slide I've got, well, quickly go forward. No, I didn't put. I will get send through to Andrew after this just all of our contact information. So if you've got a concern or you know someone with a diagnosis, you can get in touch with us if you're anywhere within the South Yorkshire region, and we can help support you in whatever way that we can. But does anybody have any questions? It can be about the charity or anything that I've covered, and I'll do my best to answer it.
I do have, but I think I've asked a lot.
Okay.
I've always heard about stages in cancer, stage 1, 2, 3, 4. Are there stages like that when it comes to prostate, like that stage 4, stage 3, whatever the stage is, however they're measured, I don't know. But it's one thing that I've had, stage 4 cancer, stage 2. Does it happen in prostate as well, prostate cancer?
Yeah, so it happens with all types, no matter what the primary is. And it's just basically the doctors use it to kind of show the extent or the spread, basically in the most simple terms, of cancer. So how far it has spread from the original tumor, which if we're talking about prostate cancer, then would be prostate. So if it's just contained to the prostate, that would give you, you know, stage 1 early, an earlier stage. Whereas, you know, for someone who's had a late diagnosis and the cancer that did once start in the prostate has, you know, spread to all over the body, you're looking at the later stages. So they just do it in stages based off where it has spread to. Does that, if that makes sense? But yes,
it definitely does. Then one or two more things. Well, obviously, thank you very much for that. I'm very sure some other people may want to ask as well. But I would also like to advocate, it could be beyond your decision to make, but if you can, when you go back to the charity, how can we engage and connect so that this charity extends its services to countries like Uganda in Africa, whereby there could be opportunities for people as well, like yourself and others, to go out there, see what can be done and how they can be helped, so that we don't stop just on these online meetings, but also have you travel. And the charity engages far and wide, like you're from Australia, then some people from here, some are others from there, then we make it bigger, better for everyone. That's a thought to have. And lastly, on the 10th of October 2026, every year we host the Uganda Independence celebrations, and I would love to invite the Purple Bars to come and be part of that, because you'll find a big community of people of African and Caribbean heritage there. So if you pull up that big Purple Bus, I'm very sure there'll be good engagement with the community. Thank you.
Yes, absolutely. That sounds great. And yeah, I didn't mention, but the charity does have a big purple bus, which, especially if you're in South Yorkshire, yeah, we take it around mainly Sheffield at the moment, to Rotherham, and we're looking at sending the bus a little bit further. But it's basically like our support centre on wheels, and we understand that, you know, about addressing health inequalities that sometimes for all sorts of reasons, and often to do with people who live a little bit further out of cities, that they can have trouble accessing our support, and our support wasn't being accessed kind of by everyone in the community evenly. So we do try to come to different events, which we'd love to come to that day in October. And we've got, the Big Purple Bus is a support centre on wheels. So we take it out to people and meet people where they're at. And it's a little bit about us understanding and hearing, I guess, the community and what your individual needs are and what are the barriers that keep you from walking in the door, and how can we best support you. And if you ever see the Big Purple Bus around, please, you can just come in, get a leaflet, have a chat. You don't need to have a diagnosis or have any worries. You can just know for one day, if you do ever need us, or you end up meeting somebody that could need us, you can just send them in our direction. But yes, that sounds like something we'd definitely love to bring the Big Purple Bus to. Yeah.
And there is, Jane Gideon, I was going to ask if Jane Gideon can say something. And I would also love to connect with you, Jane Gideon, and see what you're doing. Ellie, do you have nationwide representation, or are you limited to South Yorkshire? And I know you've said South Yorkshire, but if people are in London, people are in Birmingham, are there a replica of such charities around the country?
No, unfortunately, Western Park, our main focus is on South Yorkshire. We do a lot of signposting to other charities. So UK nationwide is Macmillan. They're a cancer charity that, like us, support people with any type of cancer diagnosis. But I guess it's not an exact replica, I think. Although it would be great to reach different populations, that's something that the charity isn't at the moment doing. Just, I guess, the outreach that we do by going into communities. We've